Hello, and welcome to this on-demand video on the topic of Disability Competent Care Access, brought to you by the Resources for Integrated Care. This 25-minute presentation distills key information and content on Disability Competent Care Access from several sources, including previous webinars, tools, and resources produced by Resources for Integrated Care, our RIC, in collaboration with Disability Competent Care subject matter experts. The target audience for this presentation is health plans and providers who serve individuals that are dually eligible for Medicare and Medicaid to improve the accessibility of the care they provide for individuals with disabilities. The presentation will focus on healthcare facilities accessibility, including understanding and identifying various access barriers that may impede participants with disabilities from receiving care and strategies to improve accessibility. Please note that access to the links and resources referenced throughout the presentation, including the links listed on this slide, download the slide presentation from the Resources from Integrated Care website at www.resourcesforintegratedcare.com. This resource is supported through the Medicare and Medicaid Coordination Office, or MMCO, and the Centers for Medicare and Medicaid Services to help individuals enrolled in both Medicare and Medicaid programs have access to seamless, high-quality health care that includes the full range of covered services in both programs. To support providers in their efforts to deliver more integrated, coordinated care to dually eligible individuals, MMCO develops technical assistance and actionable tools based on successful innovations in care models such as this resource. To learn more about current efforts and resources, visit the Resources for Integrated Care website. The learning objectives of this resource include reviewing the multiple components of accessibility, discussing the federal disability rights laws applicable to health facilities, and sharing strategies to enhance provider accessibility. The presentation will be divided up into 4 sections. The first, understanding access. The second, federal disability laws, rules, and regulations. Third, dimensions of accessibility. And lastly, strategies to improve accessibility. First, we'll explore understanding access. Despite established laws and regulations that require equal access to programs and services, many adults with disabilities still find that they are unable to access the care they need. Accessibility is an important issue for people with disabilities and their providers. Accessibility barriers can be frustrating and exhausting to repeatedly encounter and often result in unmet care needs, sometimes with deadly consequences. In disability competent care, it is important to understand that access is a multifaceted concept for people with disabilities. People with disabilities experience distinct barriers to health care in addition to what we typically think of when we talk about access to care. For instance, adults with disabilities are almost twice as likely as other adults to report unmet health care needs due to problems with the accessibility of a doctor's office or clinic. Many people with mobility limitations face difficulties locating services or otherwise traveling a burdensome distance to physically accessible services. A recent study of subspecialty practices in 4 U.S. cities found that 22% of practices reported being unable to accommodate a participant in a wheelchair. As a result of these barriers to care, individuals with disabilities experience worse health outcomes and significant disparities in access to care. For example, they are more likely to be obese and have hypertension, falls-related injuries, and mood disorders such as depression. They also are less likely to receive comprehensive preventive care, such as health screening tests and annual dental visits. Effective disability competent care considers access comprehensively and addresses all barriers to care that may be present for the participant. Improving access in a healthcare setting requires addressing barriers to care that may be experienced by the participant, including physical, social, and cultural barriers. All of these areas are interlaced and together account for barriers experienced by persons with disabilities in accessing care. They also are connected to environmental factors that may be impacting the participant's ability to access care. For our purposes, a care environment includes any facet of the healthcare system that a participant may come in contact with when seeking care. Access barriers can be present in any of the following forms: internalized attitudes and biases, communication barriers, care process barriers, programmatic access issues, and physical access issues. What this means is that access to care for people with disabilities goes beyond accessible facilities and equipment to include communication, the care processes themselves, available programs and services, and respect for each person and their lived experiences. We will review each of these components of access later on in the presentation. Next, we will review federal disability laws, rules, and regulations most applicable within the context of healthcare. As a quick disclaimer, this section on federal disability rights laws is intended as a high-level overview and does not constitute legal or technical guidance for meeting applicable statutory requirements. Disability is defined under federal disability rights laws in part as a physical or mental impairment that substantially limits one or more major life activities. This is similar to what we think of clinically in terms of functional impairment or limitations in instrumental activities of daily living. The main point here is that the statutory definition is broad and as such covers many people with chronic illnesses and/or disabilities. It's important to understand how federal disability laws apply to the provision of health care. Becoming familiar with the basic intent of the law can help alleviate initial fears about potential liability and provide a framework for beginning the process of what is known as continuous accessibility improvement. These rules and regulations are not the only federal disability laws and requirements, but they are most applicable within the context of healthcare. They include Sections 504 and 508 of the Rehabilitation Act, the Americans with Disabilities Act, or ADA, and the federal regulations regarding Medicaid managed care as cited on this slide. According to the ADA and Section 504 of the Rehabilitation Act requirements, people with disabilities must have an equal opportunity to participate in and benefit from programs, and meaningful access to programs and services. What this means in practice is that health plans and providers must take steps to include reasonable modifications in policies, practices, and procedures, effective communication, a designated employee to coordinate efforts to comply with Section 504 and ADA activities, and grievance procedures to handle complaints of disability discrimination in programs and activities. Additionally, the Medicaid managed care regulations require states and plans to provide auxiliary aids and services to assist enrollees and potential enrollees with disabilities in communicating with plans and providers. The next section of the presentation will review the various dimensions of accessibility. As discussed previously, despite established laws and regulations requiring that all persons have equal opportunity to access programs and services, many healthcare offices are still not fully accessible to people with disabilities. In disability competent care, it is important to understand that access is a multifaceted concept for people with disabilities. At this time, we are going to delve deeper into understanding the various dimensions of access. As we mentioned before, these dimensions include attitudinal access, our own internalized biases, communication access, care process or procedural modifications, programmatic access, and physical access. Attitudes are a very impactful barrier to care for people with disabilities. These barriers can include stereotyping and biases towards people with disabilities and can present in various ways, such as speaking down to people or developing assumptions about them. For instance, assuming that a person with a disability would not be able to manage his or her own self-medication and would require support would be diminishing his or her own abilities. It is important to consider a person's abilities and limitations in caring for him or herself. The only way to accurately understand this would be to ask the participant directly and avoid making any assumptions about his or her abilities. Another example of underlying bias is images chosen for marketing content. Take a moment to think about pictures and images that promote your services, your plan, your clinic, and your hospital. We frequently see images of isolated, depressed people with disabilities being cared for, or people with disabilities being poorly portrayed by actors or models. These are easily identifiable as inaccurate representations of people with disabilities. Stronger images without biases are real people with disabilities who are active and engaged socially with others. Addressing issues in attitudinal access can improve relationships with participants as well as their experience of care. There are several steps and resources that organizations and providers can take to address these barriers. For example, training and internal discussions should aim to foster a safe environment to address potential issues. Additionally, organizations can encourage providers and staff to recognize and address internalized biases and attitudes towards people with disabilities. Biases can be difficult to identify. Resources such as narratives and videos from persons with disabilities can help to show how biases may impact their experiences. This can make it easier to look at our own actions and biases and how they may present themselves. There are first-person narratives and videos available on this slide. As a reminder, to access the links and resources referenced throughout the presentation, including the links listed on this slide, please download the slide presentation from the RIC website at www.resourcesforintegratedcare.com. Additional resources can also be found on the RIC website. Communication access refers to the way information is received, understood, and used among participants. It is one of the least understood areas of accessibility and where many common mistakes are made. Communication accessibility entails providing content and methods that are understandable and useful for people with reduced or no ability to speak, see, or hear, or people who have limitations in learning and or understanding. This includes people with cognitive and intellectual or developmental disabilities, as well as individuals with limited language proficiency. As such, possible modifications to improve communication accessibility include auditory, visual, comprehension and expression, and memory. Improving communication access can take many forms and formats, such as audio, digital, large print, pictures, Braille, readers, writers, computer-assistive real-time captions, accessible websites, and strong procurement contracts that ensure materials are always available in these formats. It is an unrecognized and significant portion of the general population that benefits from content that is offered in formats other than standard print. Providing several modes and forms of content can help reduce barriers to communication access and can significantly enhance access to care among participants with disabilities. Care process access, or procedural access, refers to the understanding of accommodation needs of participants with disabilities and how care processes can be adapted to meet these needs. This begins with asking questions to learn about what accommodations are desired. By asking the participant to share their needs and preferences, organizations honor and respect the lived disability experience. Areas of process accommodation can include physical, visual, and communications that would improve the participant's experience in the care setting. This includes asking about the details and nuances of living with a disability. These cannot be thoroughly understood unless one integrates the practice of asking, listening, learning, respecting, and incorporating information learned from people. Learning this insider information is a critical healthcare competency, and the information gained is vital to meeting participants' needs. Moreover, it gives depth to the meaning of an important disability tenet, which is when you've seen one person with a disability, you have seen just one person. Some efforts providers can employ to meet the process accommodation needs of participants with disabilities include confirm and address accommodations when appointments are scheduled, ensure that these accommodations are documented in the participant's EHR or appropriate records, and reference and review the respective documentation prior to the appointment to ensure the participant's needs are adequately met. It is important to continuously communicate with the participant regarding their personal preference and or goals related to any modifications, as they may change over time. Programmatic access refers to educating and supporting the participant in accessing the services and supports they need. These can include transportation services, food stamps, community services, and financial support. Additionally, it's critical that there is an established practice to document and ensure proper coordination and integration across services. Commonly, a member of the interdisciplinary care team is trained to help participants access these services. This slide also highlights a narrative available on the RIC website that illustrates the experience of a participant in receiving successful referrals in care navigation, which includes the integration of programmatic accessibility. Physical access is generally the most understood of the dimensions of accessibility. It includes overall accessibility, such as building and equipment accessibility. Participants should be able to successfully access the facility as well as any services provided. While physical access is probably the easiest to understand of the many accessibility areas, it is not always communicated among health plans and providers are available at various healthcare facilities. Additionally, member services, care managers, case coordinators, social workers, or other staff may be unaware of the physical accessibility of settings or facilities. However, they need to be able to communicate accurate information about providers and facilities' accessibility when asked by participants or others. Physical accessibility also includes the available of accessible medical equipment. Examples of accessible equipment include height-adjustable chairs and tables, along with dependent or assisted transfers, which make it safe for participants and staff. Additionally, wheelchair accessible scales and other vital equipment are important for getting an accurate weight of a person. It is a critical part of the standard of care for many visits, and often people with disabilities are asked to guess their weight, since a traditional scale will not accommodate their wheelchair or other needs. This is considered unequal and inadequate care. There are several resources highlighted on this slide from ADANN, the Americans with Disabilities Act National Network, as well as from Centene, a managed care organization that has taken innovative steps to improving accessibility. These resources include examples of what health plans and providers can do to address any barriers to physical access among persons with disabilities, as well as trainings they can undergo to ensure they are providing adequate physical access. Organizations can learn more from their regional ADANN network. Lastly, let's review strategies to improve accessibility. Once again, the DCC model describes barriers in 5 dimensions, including internalized attitudes and biases, communication access, care processes, programmatic access, and physical access. All of these areas are interconnected and when adequately addressed can significantly improve care, lead to better health outcomes, and enhance participant satisfaction. Reducing barriers in all of these areas of accessibility requires recognizing and addressing biases as well as continuously evaluating approaches to addressing the barriers. It is important to recognize the complexities of lived experiences of individuals with disabilities and to meet participants where they are. Providers should make the effort to be more cognizant of disability-related biases and beliefs. Trainings and internal discussions should aim to foster a safe environment to address any potential issues related to bias. Reducing barriers and accessibility in all of these ways will enhance a person-centered approach. It is important to include the participant in decision-making and to effectively communicate with them to better understand their health and safety needs. There are multiple ways that providers and organizations can improve their accessibility to meet participants' needs. These include updating policies to include all levels of accessibility addressed in this presentation, creating and implementing practices and procedures that staff can follow in order to adequately meet the needs of participants with disabilities, developing and enforcing processes that promote accessibility, and lastly, including accessibility training for providers and staff to recognize and address internalized biases and attitudes that they may have towards participants with disabilities. Training should be aimed at providing the opportunity for staff and providers to recognize and address their own internalized biases and attitudes about participants with disabilities. There are several resources that providers can access in order to assess gaps in facility accessibility and to implement person-centered planning to reduce barriers in accessibility and improve quality of care among participants with disabilities. You can learn more about person-centered care planning on the link provided on this slide. Moreover, providers may lack the capacity and financial resources to improve facility accessibility. There are currently several opportunities to reduce financial barriers for providers and incentives for improving facility accessibility. These include opportunities to offset the costs for purchasing equipment or auxiliary aids and for removing barriers to an existing facility. You can find more information on the additional resources slides on the next set of slides. The next 3 slides list additional resources and the sources cited in this presentation. As a reminder, to access the links and resources on these slides, please download the slide presentation from the Resources for Integrated Care website at www.adn.org. www.resourcesforintegratedcare.com. This slide lists additional resources related to the Americans with Disabilities Act. This slide lists several resources for more information on access for participants with disabilities. These resources include personal narratives, as well as a self-assessment tool and webinars that providers and other healthcare professionals can utilize to improve access to care for participants with disabilities. This slide lists the sources cited in today's presentation. This concludes our presentation on DCC Access. Thank you for taking the time to listen to this presentation. If you have any questions, please email us at rick@lewin.com. Lastly, we want to hear from you. Send us your feedback. As always, your input is essential in developing new trainings and resources on disability competent care. Send us your suggestions via rick@lewin.com on how best to target future DCC webinars, trainings, and other resources to healthcare providers and plans involved in all levels of the healthcare delivery process. We also welcome any feedback on this resource and ideas for other topics to explore on future DCC resources. We hope this video was useful, and thank you again for joining us.